we now move to session 2 on unequal air. And this session will explore further the lived experience of inequality and air pollution, but there will still, of course, be lots of positive actions and inspiration for all of us. We're going to hear from 4 speakers, and we will have an intro coming from Emma Hibbett, PhD student at Imperial College London and organizer of this second session. Emma, are you here?
I am. Hi, Ben. Can you see me?
Hi, I can.
Thank you so much for the introduction, and for everybody in the first session for your insightful perspectives on workable, positive solutions to fight injustice at a local to national scale. As we've heard in the first session, the burden of air pollution is not equally distributed across society. And during the next hour, our panel of academics and activists will discuss the lived experiences of environmental injustice. They'll highlight their campaigns and research on health inequalities and air pollution, and then we'll open the floor to a panel discussion to explore how our society can improve air quality for all. We hope that these conversations will inspire everyone to take up the fight for social, racial, and environmental justice. And so our first speaker in a fabulous lineup of inspiring activists and academics is Dr. Jo Barnes. Jo is a senior research fellow at the University of the West of England, where she focuses on urban air pollution and helping to raise awareness of the health impacts and environmental justice issues relating to local air pollution. So over to you, Ben and Jo.
Thank you, Emma. I needn't say any more and just hand straight over to Jo.
Thanks very much, Ben and Emma. So yeah, thank you for the invitation to speak today. Hopefully you can see, yep, there's my slides. Excellent. So yeah, I'm Dr. Jo Barnes, Senior Research Fellow in the Air Quality Management Resource Centre at the University of the West of England in Bristol. And I'm going to talk a bit about some research that we've done and others have done on environmental justice and air pollution. So on to the next slide. Starting off with some headline figures, I'm sure you've heard these throughout the day. 28,000 to 36,000 people dying prematurely each year as a result of exposure to particulate matter, fine particulate matter and nitrogen dioxide, and associated health costs of 157 million, per annum. So it's a significant issue. If we can move to the next slide, please. And we do tend to sort of focus on that number of deaths figure. However, we should also bear in mind that that is only the tip of the iceberg, if you like, and there is a huge number of morbidity issues around that as well. So ill health, essentially diseases associated with air pollution. So that's linked as well, and how air pollution affects health. So there's a lot of evidence around particulate matter, ozone, nitrogen dioxide and sulfur dioxide, particularly around particulate matter. We know that particulate matter doesn't just affect the lungs, it gets very fine particulate matter gets into the bloodstream and has cardiovascular effects, so it affects the heart. And actually the WHO have actually classed particulate matter as a carcinogen in its own right. So we know that air pollution is something we need to do something about. And it affects people throughout their lives. So children and adults are affected by air pollution when they're exposed to short-term and long-term episodes of air pollution. Even within the womb, we've heard that there is evidence to suggest that babies, or preterm babies if you like, are being exposed. So we've got low birth weights, preterm births and small babies effectively. And there's also emerging evidence that air pollution is strongly related to diabetes, neurological development. We've seen evidence out just this week around that, psychiatric disorders, dementia, a range of other things as well. So there is evidence coming out all the time to link air pollution with all sorts of different diseases. And as I mentioned, it does affect people differently throughout their lives. We've seen pregnant women, it affects their unborn babies. Children, particularly young children, are particularly affected by air pollution as their lungs are developing. And then we get the cumulative impacts of living with air pollution throughout our lifetime, affecting adults and the elderly. So within that, there are particularly vulnerable groups. So as we've mentioned, pregnant women, children and elderly people are particularly vulnerable, as are those that are living with pre-existing conditions and people that are living in areas of poor air quality. And we'll talk a little bit more about that in a second. So just to introduce this Venn diagram. So this is what we call a quadruple jeopardy effect. So here, this is building on previous work by Jeffery et al., which is identifying the first three linkages. So people who are living with low socioeconomic status, people living in deprived areas, are already suffering ill health associated with living in those conditions, and are also more likely to be living in areas of high air pollution. Those three things are already recognised, but if you consider the vulnerable groups within that as well, and the particular susceptibilities of pregnant women, children, etc., then we've got this quadruple jeopardy effect. And while the Venn diagram suggests that that's only a small overlap, actually that's a much bigger overlap. This obviously isn't to scale. So some of the work that we have been doing around this to illustrate, so this slide demonstrates some work that was done by a PhD student of ours, Hugh Brunt, who works for Public Health Wales, and he was looking at areas in Wales and comparing data on health statistics and deprivation. And actually he found that rather than, yes, the two were associated, but actually air pollution was having a multiplicative effect on health. So actually the two combined, the effect was stronger than the sum of their parts. And some further research that I've been doing or have done with Tim Chatterton and Jim Longhurst was also looking at exposure to air pollution and households in poverty. And here you can see in this graph that on the far right hand side of the graph, those areas with a high proportion of households in poverty are exposed to higher concentrations of nitrogen dioxide, whereas at the other end of the graph, those areas with fewer households in poverty have much lower concentrations of nitrogen dioxide. So there's a clear issue here, as other speakers have mentioned in the first half of this session. Moving on to the next slide, the first graph, or the graph on the left-hand side, is the same as the one you've just seen. The one on the right-hand side is showing actually the generation of pollution. So we've still got households in poverty along the bottom axis, the x-axis, but on the y-axis, we're here now showing the total private vehicle emissions per household. So in contrast to the one on the left, you can now see that areas with a high proportion of households in poverty are actually not the ones that are generating the pollution. And I know some speakers have alluded to this earlier, and actually here's some evidence to suggest that. I should mention these figures are across England and Wales. So quite clearly there is an environmental justice issue here where people in poverty are exposed to air pollution but are not the ones that are generating it. And unpicking that a little bit further, we can see that that is because they are the one, they have lower, so households in poverty have lower private vehicle emissions per household, but that is because they are less likely to own a car in the first place. They are certainly less likely to own multiple cars. They have less, the vehicles they do own tend to have a lower NOx emission factor, so they're generating per household an average figure of less NOx than more affluent households. They're also less likely to own diesel vehicles and definitely less likely to drive as far as more affluent households. And although they are likely to have older vehicles on average, they are on average just only over a year older. So actually there's quite a contrast there. However, as we've seen, they are exposed to the highest concentrations of traffic-related pollution. And just moving on to the next slide here. So this is some research by others, Mitchell, Norman and Mullen, which was looking actually at two census periods, and actually this is 2001 to 2011, and showing between more affluent areas and more deprived areas, the change in pollutant concentrations over that period. So Q1 here relates to people in more affluent areas, whereas Q5 is more deprived areas or more deprived households. And the blue bars represent the concentrations of nitrogen dioxide in 2001, and the red pink bars illustrate the concentrations in 2011. So you can see for the more affluent households under Q1, the concentrations have improved hugely over that time. Whereas if you look at the other end of the graph in Q5, the concentrations are higher and haven't reduced by nearly as much. Other research they've done or within the same paper also demonstrates that actually for particulate matter PM10, concentrations have actually increased more in poor areas. Now, recognizing that this is now nearly 10 years old, it will be interesting to see whether or not in the next census, whether that data still continues, whether we still start to see those increasing inequalities in the next census. And in the last slide, really, apart from my summary slide, I just wanted to highlight also that air pollution is also related to a number of other health determinants that are particularly affecting people in low socioeconomic status. So here is some work that we contributed to from the European Environment Agency, which was also looking at the combination of effects of air pollution, noise, and heat as well. So when we think about environmental justice, we need to really think about the whole picture of exposure. So yeah, just really to summarize in the last slide, we know that air pollution has significant effects on health and quality of life as well as on mortality. And there are different health impacts throughout the life course, particularly vulnerable groups include pregnant women, young children, the elderly, and those with pre-existing conditions. And there are
yes, that's your time, Jen.
That is my timer, so that's telling me to stop, isn't it? Have I got time to finish the bullets, or should I just leave them there for people to read themselves?
You can leave them there for people to read.
Excellent. Okay, that wasn't too badly.
No, great. Thank you very much, Jo.
Thanks, Ben.
Our next speaker is Sufiyan Abdul-Qayum from the campaign group Clean Air for Southall and Hayes. Sorry. Sufiyan is the youngest member of CASH, and he will be speaking about the campaign's fight against environmental injustice in their community. Are you here, Sufiyan? There you are.
Yes, I am. Sorry, I was on mute.
Right, over to you. You've got your 8 minutes.
Yeah. So yes. Well, firstly, I would like to thank Emma for getting us in contact with Global Action Plan. And second of all, I want to thank Global Action Plan for obviously letting us speak at this event today. So as mentioned by Ben, my name is Sufiyan. I'm the youngest member of Clean Air for Southall and Hayes, also known as CASH. I became involved with campaigning against the air pollution from Southall Waterside, which is a formal gasworks site which is undergoing regeneration, as I believe it has had a negative impact on my health and the wider community's health. Now, what roles do I play in the campaign? Well, I'm an administrator for the group, as well as I play a key role in the campaign strategies, including organising public meetings, such as the one in July, which held Ealing Council accountable for failing to take action against Berkeley Group, the site developers. Just a bit of background about the site now. So Southall Waterside is the largest brownfield site, the largest brownfield redevelopment, sorry, in the UK, and no model exists for developing the site with such a range of dangerous chemicals next to homes. The development will provide 4,000 new homes, leisure activities like a cinema, and retail space alongside the Crossrail route into central London. Now, CASH totally understand the need for new homes in the capital, but the cost of the development to the local community's health are far too high. So it's, in our opinion, it's not worth it to obviously affect thousands of people's health just to put another 4,000 homes into Southall. Now, I don't know if Ben's got the slides, which, yeah, if the media slides, sorry. Yeah, so there's a list of our media, our social media, so you can check us out on social media, where we've been featured in The Guardian, we've been featured in My London and The Mirror several times, just talking about our story. And yeah, so just a few other points I want to mention. So we've actually been in contact and liaising with a group called Mapping for Change, who have developed an app called Odor Collect. You can use it nationwide as well as internationally to report odors on your phone rather than contacting your council or your local authority, because in Southall, we found it very hard to get through to our local councillors, our local MPs, to complain about the odour. Now, there have been spikes of particular matter 10 and particular matter 2.5, which, as Araceli mentioned, are very dangerous to your health. And unfortunately, in our group, we have actually lost there's a group member who actually lost her mother to lung cancer, which she strongly believes was the cause of this site. The site was held, well, she wants to hold the site accountable for it. Obviously, we can't prove it's the site, but it's a very big coincidence that people are developing lung cancer, pneumonia, and there's a 7-year-old girl in Southall sleeping in an oxygen tank just because she can't breathe. Now that is something which was very hard hitting to myself when I first heard about it, and that is featured in the Guardian's film. So if you would like to look at that, the article will be, it's called Is My Neighbourhood Poisoning Me? And it's about a 14-minute documentary on the Guardian website. The asthma rates in Southall are actually 30% higher than the national average. From these statistics from the year 2016 to 2019. And Southall Broadway and South Road, which are the road right next to the site, are actually the highest polluted roads outside of the ULEZ, which is the ultra low emission zone. Obviously that is also quite concerning, because I understand this is a clean air meeting about the wider air, but I just thought I better mention the site, because that site is very polluted, and across Southall, the amount of pollution we get is absolutely ridiculous. We've had residents' complaints of coughing out blood, having nosebleeds, having nausea spells. So it was all quite hard hitting to myself when I got involved. And that's why, as a 19-year-old, I'm very committed to this campaign. And I've been going strong on it for the last 2.5 years since we've come about. So yeah, thank you very much, Ben, for letting me speak today. And thank you very much, Emma, once again, for getting us in contact with Global Action Plan.
Thank you, Sufiyan. I mean, yeah, I just exactly what our previous 6 speakers have been speaking about, and the injustices on around particular sites, around particular roads that you and your community are living that. So thank you for sharing that experience. We'll have some questions for you at the end, I'm sure. So,
yeah,
stay with us. Up next, we have Jeffery Smith. I believe he's here. He's a consultant with the World Health Organization. Jeff's consultancy work examines urban health and air pollution with a focus on citizen science and community engagement. Oh. We seem to have lost you, Jeff.
Hello?
Yep, there you are. Hello.
Okay. Could you hear me before?
No, this is the first words we've heard from you.
Okay. So thank you, Ben and Emma. First, I want to thank the Global Action Plan for inviting me to speak this year. And I must warn everyone that I have a habit of including more slides than time allows. But that's because I like, in these days with the recorded sessions, viewers can pause and see the studies and look at the research for themselves. So let's see, to advance the slide, I don't see an arrow. Ben?
You can just press the slide and it should move, but just give it a moment. There's a bit of a lag there.
So I've just clicked the slide.
Should move.
No.
Ah, there you go.
Okay. So yeah, our national governments determine what choices of energy and materials and processes we have. And we need to look at who's the most vulnerable. And this slide, the blue and red dots in this graph represent 40 different causes of death in WHO's review of the progress towards health-related sustainable development goals. When WHO works with its partners, they concentrate and focus their attention on who's the most vulnerable. And I believe this is something that should extend to city and community managers, and they should do the same. So around 20,000 people a day die due to air pollution globally all around the world. Dr. Maria Neira, the WHO Director of Environment, Climate Change, and Health since 2005, she likes to share that we really don't need any more evidence. Dr. Neira and her team have identified more than 70,000 scientific papers to demonstrate how air pollution is affecting our health. Some of the other speakers have already mentioned this, how diesel particulate and all particulate PM2.5 is a cancer causing, but we also know that ozone in cities and in certain neighborhoods, the NO2 oxides of nitrogen combines with ozone and is creating other hotspots of air pollution that we need to look at. So in this slide, we have, I'd like to turn now to kind of nanoparticles and what recent science has found out about nanoparticles. I've added a black blob here, you see, underneath those viruses, and that is diesel particulate. And the average diesel particulate is 18.5 nanometers. Just suffice to say, it's average than most viruses. It's smaller than most average viruses. There we go. Okay. And so these nanoparticle researchers, they found in human lung cells, after they were exposed to wooden burning smoke, they found that the lung cells on average died within 4 hours. That's represented by the blue bars there. The green bars are these researchers, they generated ultra clean black carbon nanoparticles in their laboratory, which didn't have any toxins from the exhaust of the smoke, from the wood burning, like formaldehyde and others, or attached to them. And in those cells in the green, you see that to the control, the yellow, there wasn't any more death. So what does this tell us? This tells us that black carbon particles are carrying the toxic gases on their surface, a lot like a Trojan horse. And because these particles are smaller than viruses, they can reach our bloodstream in every organ of the body. Oh, sorry, I went too far. Can I go back one? Ben? So researchers counted the number of particles emitted between Euro 3 and Euro 6 diesel engines. And here you can see at the bottom, the Euro 6 diesel engines are still emitting 100 billion particles every 2 minutes in the space of about 7 cubic meters. That's like 7 double door refrigerators. So what does that tell us? That we have a lot of these particles. But we hear a lot about diesel, but Swiss IMPA researchers found in a long list of toxins in the emissions of petrol vehicles too, just in the last 3 years or so. Benza-alpha-pyrene is especially nasty one that causes cancer as well. WHO doesn't want us to have any of that in our environment. It's a major pollutant that enters our homes through and bloodstreams, of course, from wood-burning stoves, fireplaces, incineration hotspots, and of course, vehicle exhaust. And I want to point out that a lot of these sources of pollution have been located near communities, poorer communities over history around the world. So researchers found that the cancer-causing potential of benzoylpyrene in the acceleration of exhaust of Euro 5 and Euro 6 petrol cars was up to 1,700 times greater than the EU standard and 6,800 times greater than the UK standards. Here we have black carbon nanoparticles that reach every organ of the body. And in this image, we can see that the nanoparticles have reached the fetal side of the human placenta. This was discovered also in the last 3 or 4 years by researchers at the University of Hasselt in Brussels. So I don't have time to go into this one that much, but experts have long been able to measure the length of the DNA structure of telomeres. And so we now know that air pollution, that mothers exposed to greater levels of fine particulate air pollution in the study they found gave birth to newborns with shorter telomere length. And so telomere length is known to be associated with our life expectancy. So in other words, some children are being potentially pre-programmed with a shorter life expectancy when they're exposed to more of these PM2.5 fine particulate particles. So for the rest of the time I wanted to turn towards solutions and ideas and what we can do. And this study identified affordable tailpipe emissions controls that we can retrofit on all those older Euro 5 diesel vehicles that are still running on our roads. That doesn't help with the petrol vehicles and beta alpha pyrene, but it does help reduce NO2 in the cities. So why should we try to monitor the progress of SDGs? No, not why we should, but we should monitor the progress of SDGs, not just at the national level, but also at the community and local level. And we can get together citizen scientists, community activists, corporations, city managers, and we can all come together and create this open data, because that's transparency and low cost capacity, which is going to allow us to do what we need to do. So, but to do that, we need to know which communities, regions, and areas are making progress. And this is a problem because a lot of that data is not available, or it's all bundled together, and we need to disaggregate that. But we need to spend money on this type of disaggregation and acquisition of data, all data, not just health data, but health-related data as well. So I wanted to show here that John Snow, the father of modern epidemiology, it's the guy at the top, not the guy at the bottom. But he just went into communities and asked questions and mapped the results on a map. And this is something that citizen science does. And so we can see and hear lots of traffic, as you can see in the insert that I've put there. But the solutions is going to have to be that we do something different, and that's what we propose. And citizen scientists have made maps that we can map and show hotspots of air pollution. We need to integrate our data types and sources to be able to know what actions are making that impact. And so integrating that data, again, as I mentioned, is also key to help reduce the burden of disease. Thanks,
Jeff. I'm afraid we're going to have to cut you off there. Okay. I mean, we could continue that talk for probably another hour. Yes. There's a lot there. I'm so sorry to do that to you. We'll have questions for you. Right. Yes, we'll have questions for you.
I'll summarize in the questions.
Cool. Now we're going to move to David Smith, who is the founder of Little Ninja UK. Dave's Little Ninja campaign focuses on reducing children's air pollution exposure and champions the fight for environmental, racial, and social injustice.
Hi, Ben, and thank you to Emma and the Global Actual Plan, and thank you to the speakers who've come before me. You've said it perfectly. There's lots I could talk on my presentation, which I no longer need to. Just to highlight a few things, the question earlier from Kate around where do those children who are exposed to illegal levels of air pollution, where do they spend their time? Nursery, playgrounds, high streets. From Araceli, whose voices we silent, and Rosamund, the bit there around those who contribute least suffer the most, and exposure to 10 cigarettes a day, passive smoking for children who live on main roads and go to schools on main roads. And it feeds in perfectly to my campaign, Little Ninja UK. It started up 3.5 years ago when I discovered that my child was likely to have between 5 and 14% reduced lung capacity because we live on main road, but also because of the time we spend walking on main roads, the potential for him to go to nursery, our local nursery on a main road, our local schools on a main road, and that kind of real world health exposure to air pollution. So I started campaigning. It was Little Ninja UK. We discovered that kind of part of the problem was all this congested idling traffic, whether it's in traffic or actually if it's parked outside schools or our home or a nursery or a hospital, GP, surgery. And so we started the No to Idling campaign, NO2 idling. It's still there on change.org, please do sign. And it really was around saying there are things we can do to reduce exposure just by reducing the unnecessary burning of fuel, which is what happens when people leave their engines running just to charge a mobile phone or, you know, to stay warm or cold, to cool down. So from there, we kind of understood, has been shown today, the impact on main roads in terms of for the unborn child, in terms of being born early or low birth weight, the impact on IQ and intelligence, cognitive development, but also on children in terms of more chance of pneumonia, and also asthma, and as we mentioned earlier, the reduced lung capacity. So this year, it kind of hit us for 6 with coronavirus. And once again, it is the poor and the BME communities who are most at risk. I, as a black male, 4 times more likely than a white male to die from coronavirus. When you strip out the social economic factors, still twice as likely. And the link between air pollution and coronavirus, higher levels of air pollution equal increased infection, also increased death rates. So when we look for this kind of opportunity to have a COVID emergency response, part of me inside is kind of celebrating because actually it's going to tackle the air pollution problem as well. And it seemed to be doing that at first, when the idea was to actually reduce space for cars on main roads, increase space for cycling, increase space for pedestrians, increase space for buses, 24-hour bus lane. And this not only reduces air pollution on the main roads, but it also increases the distance between the vehicle exhaust pipe and the people on walking and scooting along these main roads, particularly the children who are closer to the source of the air pollution, the exhaust pipe, and babies in buggies who are even closer, up to 60% more exposure than an adult. And obviously they breathe more rapidly as well. So very excited about this. When the Mayor for London started doing this, myself very excited about these main roads. And then the money came down to councils, and the decision was, what are councils going to do? And there was a list of things they could do, which included things like school streets and tackling car storage on these side roads, because, as you know, very busy, both sides of the side roads filled with cars makes it difficult for social distancing and difficult to cycle through, because obviously you might get hit by doors opening and so on and so forth. So I was a bit shocked to find out that the solution being put forward was low traffic neighbourhoods, which is actually to reduce traffic on these quieter, less polluted side roads by closing them to through traffic. And these are the areas of high car ownership. But when you close these roads, that traffic is displaced to other roads, other residential roads, particularly in cities like London, Birmingham, Manchester, and Liverpool. These roads aren't arterial roads and distributor roads, and that's how they're described, and main roads and where traffic belongs. No, these are residential roads. These are our homes. These are our schools, our nurseries, our hospitals, our GP surgeries. These are our high streets. These are places where we live and breathe, and we are already exposed to the highest levels of air pollution. And that seems to just be pushed to the side in this eagerness to what it appears to be to reduce traffic and air pollution in areas of low air pollution, the side roads, in order to make it nicer so that car owners might think about driving less. Now, it kind of sounds like a good plan. And when you look at the studies around Waltham Forest, and you think, actually, look, air pollution fell, traffic fell, and you've got this thing called traffic evaporation, where traffic will disappear. And you kind of look a bit deeper into the evidence, and you suddenly find out, actually, I don't like to use the word maybe tall tale or a good story, a very compelling story. But when you look at really at the evidence, traffic in Waltham Forest actually increased. Car use didn't actually decrease, not significantly. There are trends, there are suggestions of these things might happen, but did it? No. Even the NO2 data is modeled on, but actually includes things like ULEZ and Euro 6 cars and lots of other things rather than responsible by the LTN. So in terms of the LTN, given these benefits, the evidence from what I see just isn't there. In terms of traffic evaporating, well, actually, even if you get 5% evaporation because you've closed these side roads, maybe even 10%, let's say everything was working perfectly, you got 15%. 85% is still going and being displaced on the main roads where people are already most at risk, and not just anybody. These are the groups who are least responsible, very low car ownership, they already walk, they already scoot, they already use public transport. These are almost the heroes of climate change and air pollution in terms of doing the right thing, and they are being disproportionately punished. So I first came across this in Stoke Newington, where parents there kind of highlighted the issue, 3,500 children at local nurseries and schools on the main road, side roads going to be closed to make an LTN and push that traffic to the main road. And they protested and they did all the right things. They got into the TV, ITV, into newspapers, and the council did a survey and they did a consultation, and it showed 70% said, we don't want it. And so it was held at bay. But now, due to COVID, emergency says, actually, we can just enforce it. And they say, well, hang on, consultation. Don't worry about consultation. We're going to impose this. What about equality impact assessment? We're going to impose this. So this is a situation now right across the UK. And it's really neat to say there are voices like myself. I'm a cyclist. I'm an ambassador for cargo bikes. I'm not a motorist. I'm not part of the motoring lobby. My voice doesn't get heard. The millions of people who live on these main roads isn't being heard. Now, I'm running out of time. Any questions, please? I'm on Little Ninja UK on Twitter and David at littleninja.co.uk. So please do get in touch.
Thank you, David. That's the alarm. And thanks for sharing your concerns on that difficult topic. I think we can agree that evidence is mixed, and there are a number of factors at play for road traffic increases on main roads at this time, not least of all because of coronavirus restrictions on public transport. But I think you and I and everyone on this panel can agree that we need to drastically reduce motor traffic on both main and residential roads, and that can be done with the right mixture of interventions. Hopefully we can use this Q&A time, so we have, I think we might be a bit ahead of time actually, to unpack some of those issues and interventions. So I'd like to thank our speakers and go back to our first speaker, Joe, and I'll start the questions there. So Joe, how can we manage the compounding threats of air pollution, noise and heat, which disproportionately impact vulnerable groups?
That's a massive question, Ben. Thank you for that.
You're welcome.
Well, I guess that's the challenge, isn't it, really? Yeah. Yeah, thanks for putting me on the spot. How do we manage it? Well, I guess by looking at the sources, essentially. So I think there's three different ways that you can reduce the impacts. You can either reduce those that are being exposed, move the receptors, if you like. You can reduce the amount of pollution that's being produced by a different source. So, for instance, going for electric cars rather than diesel or petrol cars. Or you can remove the source. And given the number of co-benefits associated or sort of combined effects, I think that actually that's probably the better option. I know it's more difficult, it's obviously more challenging, and some might say less feasible, but ultimately I think that's really where you need to to gain the biggest impact. So for instance, pedestrianising a street, for instance, you're going to get rid of both the air pollution and the noise and all of the other associated things such as road safety, for instance. It's going to improve. So yeah, I mean, it's more of a challenge for local authorities and for governments to do that kind of thing, but actually that's where the biggest gains are to be made. So.
Well, thank you. Sorry about the tough question. I
It's okay, no, you just put me on spot.
Okay, stay with us because there'll be more questions cycling around. I have the next question for Sufiyan, and I mean I have one hard one for you and one easy one for you there if you're there, Sufiyan. So I'll start with the easy one, which was, how did you get involved in community campaigning?
Yep, am I muted? Yep, yep. Well, how I got involved was actually when I was 14, I was just at my local library, and where my local library is situated, there's a community hall right next door, so they were advertising for a meeting. Said a public meeting, come along and voice your opinion. So that's what I went and did, and then voiced my opinion there. Got headhunted by Clean It for Southall and Hayes, and then got in touch with Angela Fonzo, who is another member of the campaign. And one of a mutual colleague between myself and Angela, he actually vouched for myself to Angela Fonzo, who, as I said, manages the administrative side of things. And then, yeah, so I got sort of headhunted by them, and then I do a lot of their administration work now and digital marketing for them.
Great. Are you responsible for the very cool acronym CASH?
No, I'm not. I can't take. I can't take. I actually don't know who is.
Worked out very well though. Cool.
Yeah.
Thanks, Sufiyan. I'll cycle back around to you with another question a bit later. So Jeff, you started by saying we don't need any more evidence. We have enough evidence. How is citizen science different, and how can it help achieve environmental justice?
So yeah, I guess that would probably be my summarizing slide, really, because as I was mentioning in the last 2 or 3 slides before I ran out of time, is that we can all work together, and we have to work together, and it's when this data is open and available that in the communities that then the awareness occurs. And so this typically starts at the city level or the courts, where we're able to make the kind of reforms that are required. So there are many examples of how risks occur in minority communities. For example, there's Flint, Michigan, and the water in parts of the southern U.S. There are, let's see, well, Hurricane Katrina. 50% of all the deaths were amongst the African American community. 80% of homes that were destroyed or damaged during that hurricane were in the African American community. Also, you go north of there, there were not homes built near pollution sources. There were pollution sources built near homes of African American communities. And so this type of environmental justice, we're all better off when we're all better off. I'd like to say that, as I mentioned about the flooding, right? This pollution that's happening in communities in places like London and all around the world because of these nanoparticles that are invisible, but view those as waves of pollution. These waves of pollution are hitting people where they live, and we've got other communities, and it's okay. We should create little islands as safe havens, right? But we shouldn't leave the people who are on the front lines there behind and vulnerable to those waves of nanopollution that we're seeing. Are they're damaging DNA. The telomere length means that potentially it could damage the DNA of the children and grandchildren even. We don't know that yet, but science has to research that and find that. In other words, let's not leave people to sink or swim, right? We all need to do this together because we're all better off when we're all better off.
Thanks, Jeff. That's a lovely saying. Sufiyan just wanted to come back on something that that he was talking about previously. Sorry, Dave, we'll get to Sufiyan.
Yeah, hi, sorry, yeah, I did actually forget something to mention while I was doing my talk. Obviously I am from CASH, Clean Air for Southall and Hayes, but we are also part of a wider alliance called Gasworks Communities United, who are a group of campaigners who are suffering environmental injustice at the hands of Berkeley Group, the site developers. So we're a group of people from Brighton, Hornsey, Leighton and Southall. Yeah, so that is another channel. If you want to reach out to us, you can reach us out. You can reach out to us on Gasworks Community United. That's another channel you can reach out. Yeah.
Cool. Thanks, Sufiyan. Sorry to interrupt the flow there, David.
Sorry about that.
You mentioned some voices are being excluded from debates on air pollution, which is something, of course, that Araceli and Kate also mentioned in that first session. How can we ensure that more community voices are heard in political discussions around air pollution?
Well, I'm delighted you asked that question. I actually had a quote which I was hoping to mention earlier. It was from Sufiyan. They said, for healthier, happier and fairer cities where all communities can thrive, we need to ensure the often unheard voices are heard, amplified and included in urban design discussions. Ties in perfectly what Jeff just said in terms of, you know, we can all work together, leaving people on the front line behind. You know, it's not to have a debate about LTNs, but just using it as an example. It's a wonderful scheme in terms of on paper. The story is compelling. It's needed in terms of ways to reduce car use. I think we all agree more active travel is actually better for our individual health, but also for society. How we get there, how we do that, that should be a discussion that includes everyone. You know, the discussion in terms of the design of the low traffic neighbourhoods has been going on for years and years and years. If we were honest and took a good look at the people who designed it, and kind of, I think we'd find, and if I'm wrong, it'll be great if someone can outline that. I think we'd find that it's mostly white, affluent men, and a percentage of women, but mostly men, probably a lot able-bodied. And so therefore, when you look at that and then you see consultation, and again, it will be those who have time on their hands to log in, do what they need to do on these different, you know, community websites and stuff. And then when it reaches that kind of point of going to the councils, again, the councils don't necessarily reflect, you know, London's diversity. You know, it's 40-odd%, you know, BAME. So, you know, I think it's that one which is, when you have these kind of schemes, can they be designed to be so inclusive that when the output comes out, it actually reflects the ideas and the desires of all of London, all of the communities, particularly when you're going to put it into such a diverse community like Lewisham or Brixton, you know what I mean? What's the impact going to be? Because I think that's been a lot of the issues. It's not that low traffic neighbourhoods are bad, it's actually the way they're actually being implemented, what actions have been done for the main roads and the residential main roads. How is everybody being included, and is everyone's voice and ideas being heard? I think when we get closer to that point, I think we'll find less kind of animosity, and certainly there won't be a need for me to come and talk about these issues because, you know, they'll already been included through the design.
Thank you, Dave. I see we still have Rosamund with us, and I wondered if you wanted to pick up on that, Rosamund. So, you know, how do we do it? How do we include voices and make sure that health and social justice issues are addressed?
I think we're going to have to probably ask doctors to speak out, because we've all admitted that the people who are most affected, they are not engaged. I think, as David mentioned right now regarding low traffic neighborhoods, and for me personally, I am never, ever going to find it acceptable that a scheme can be introduced that young people who already have asthma, it will exacerbate it and they will end up in hospital. And again, the problem, like air pollution, we don't see them. You would need to go to A&E and they will be there, just because we don't see them. So maybe someone's going to have to speak up on their behalf, or we actively engage them. We know where they live. We know they're on main roads. What do they want? Have we asked them? We seem to make decisions for them rather than asking them. How can we implement something that they are even worse off? And I have asked Jo for her slides because I was really interested in NOx straight away. So we already know these things. How can we make life in 2020 even worse for these young people? And I repeat it again, and it's not pleasant. And those of you that know, my daughter wasn't the only one to die. 12, and this is just in London, up to 12 children every year die. And if the pollution right now is worse, we're going into winter season, we have COVID, it's not a nice conversation. This isn't frightening people, by the way. This is being honest and speaking the truth. We keep on saying we care. We keep on saying all these things. How can we design something that some people can get better at than others? How can we do that as a society, that those who are already suffering are even suffering more? Personally, I don't understand it. I'm going to read Jo's slides again to get more of an insight into. No, I really.
Sure. Yeah, we're going to hear from Jo again.
No, I really don't understand it. And I need to read more to understand how you can implement something. And I have asked doctors, and I'm going to make more noise about it. They need to speak up because we clapped for the National Health Service. So I know people trust them. They treat these young people, so people don't think it's just me saying it. They need to come out the same way they were about the tobacco, how doctors fought about it. Remember years ago, they need to come out about air pollution. I want to hear doctors' voices. They need to lobby the government now. I've said it. I bet you they're sitting there going, we've got enough to do without you increasing our workload. But no, they've got to do something. You can't have young people being rushed to hospital in the middle of the night in 2020 because of a scheme that's been introduced. It is unacceptable.
Well, I think the fair thing to say is, air pollution is what's rushing people to hospital, regardless of any intervention or scheme that's currently taking place. But I accept the sentiment.
No.
I'm going to have to ask.
We'll have to disagree on this. There's spikes in air pollution. It is a spike in air pollution that causes asthma attacks and heart attacks. It's not the actual scheme, it's a spike in air pollution. Sorry if I wasn't clear about that. I do apologize.
Yeah.
So yeah, it is the spikes in air pollution. No one has on purpose designed something that is sending children to hospital, no. But when people have come up to you and say, this isn't working, our children are suffering, people need to listen. Those in higher places, like David said, they need to be listening.
Yeah, thank you, Rosamund. And not to put too fine a point on it, but somebody did design something that's causing air pollution, and it is the car. So I got a question for Jo, and hopefully this one won't take you too much by surprise. It's just about the key areas scientists should focus on over the next few years to help combat social and environmental injustice.
Yeah, again, it is a bit of a tricky question. Yeah, you have stumped me again, Ben. I really should be better prepared for these questions, shouldn't I? There isn't really a single issue. I think that's the thing. I think that's the thing that's come across from a lot of these talks as well, is that it's very integrated. And I think that is what we need to take to heart, is that we need to be thinking not about issues in isolation, but how do we actually manage not just whether or not people are being rushed to A&E in terms of sort of acute impacts, but the chronic impacts throughout people's lives, and how we deal with these disparities of effect as well. So it has to be dealt with at a more kind of systemic level, in thinking about planning, in thinking about transport planning, and thinking about sort of how do we design the places that we live. So yeah, I'm not sure if I went completely off topic there and started answering my own question, but I think it was more about kind of where the researchers need to go rather than where policymakers need to go. But I think the research needs to be done to inform the policy. So yeah. Obviously, there's some more work to be done around understanding any linkages between COVID and air pollution. A lot of research that's being done on that at the moment is indicative as work that's coming out, but it's not really peer reviewed. So more to clarify the linkages there potentially could only strengthen the argument in both cases. There's always more work to be done on the combinations of pollutants as well. So when we talk about the health impacts of PM2.5, fine particulate matter, and the impacts of nitrogen dioxide, we can't really think about the impacts of these things separately because we don't live with pollutants separately. We live in a cocktail soup of pollutants. And so what we really need to understand from the science is what are the health effects of the combined impacts of those pollutants. So there's a lot of work to be done there. Yeah, now you've got me thinking. There's lots.
No, I could see,
you can stop me now if you like.
I could see Jeff nodding along to what you were saying. I wondered if he wanted to come in now.
I'm sure he does.
Yeah, just to segue to that, you know, because this is it requires a holistic response. But I was just thinking that, you know, if COVID and what Rosamund had said too, and we've all thought about it and we've seen Build Back Better, but also if COVID has taught us anything, it's that the asymmetrical threat to our health and safety is far greater from things of how we treat and mistreat the environment. And we've got decades of data and information, as Dr. Nera had mentioned, 70,000 documents, right? So we know this is happening. We don't have to find any more evidence before acting. We do need to collect more data to know what we're doing and what works best so that we're making good, intelligent investments. But to move that, the investments, we need to think of this, we need to invest as much in health, and we need to bring health in all policies to everything we do. And we need to invest in at least as much as we do into the military threats that that nations face. And I served 14 years. I don't look it in the Army Reserves and the U.S. Army on active duty. And so I've seen a lot of investment, and we can do the same sort of investment. And our medical professionals are the new heroes, and the greatest asymmetrical threat to our health and safety is from how we mistreat the environment and how that causes death, disease, and disability. And then the last thing is clean air is a human right as well. If we think of clean air as a human right, Rosamund? It was, is it David Boyd? Who's the UN special reporter who discussed and goes every year to the UN and asks them to consider clean air to be, and water and food to be a human right. And we need to think this way. That's all.
Thank you, Jeffrey. And I have to wrap up now and thank all of our speakers at this double session, Kate, Araceli, John, Rosamund, Penny, Emma, yourself, Jeffrey, John, Sufiyan, Dave. I hope I've not missed anyone there. Thank you all so much for joining this session and joining this debate. I think I'm going to have to watch it back and take notes this time because there's so much to unpack, and I hope that we can talk again soon and learn from each other because there's a lot we need to do here. So thanks for joining us. I'm going to close off now, and there'll be a video before we move into our next session.